Hello everyone, great to be here with you today. As I've advised, I will go through some more, a refresher around the consultative mechanisms. I'll then also talk about WorkSafe's new strategy for work health and safety and things that we're doing there. And we'll have some time for questions after we hear from Steve as well. All right, so provisional improvement notices. Again, a little bit of a refresher, but the things that we should be looking at here is firstly consulting with other safety and health representatives and the person to whom the notice is to be issued, because, every effort should be made to resolve a matter if it is possible to do so without using a PIN. A PIN does make things all a little bit more formal, so if it's able to be done through consultation, then we would recommend it, because when it is written, it is a formal requirement for the person that's been issued the PIN to comply or to go through the review process for the PIN. The PIN does need to say which part of the legislation is being contravened, and that can actually be a little bit tricky sometimes. The legislation, as we just heard, is quite extensive, and some parts of it actually are kind of more informative, and other parts of it are actually described breaches. So usually the ones that are more informative don't have a penalty sitting next to them. So it is a little bit tricky sometimes to figure out what the best provision might be for the contravention. They do need to be displayed at the workplace, and the compliance date needs to be more than 8 days. So particularly if you've never written a PIN before and you're looking to write one, then we do recommend that you speak to someone at WorkSafe to clarify anything that you might have questions about or be uncertain about, because if it does get reviewed, then we will have to consider both the fundamental issue about the reason for why the PIN was issued, but also a level of technical the technical level to which it's written that does actually have the required elements under the Act. So that's important. Okay. All right. And I think this is just going to take us through there in a little bit more detail. All right. So if the recipient does seek a review, then the inspector will, as I say, look at all of those issues in terms of the fundamental issue and also how it's been written. And the decision can be that the provisional improvement notice is either it might be cancelled if either the issue was considered not to be a breach or it's got a technical issue. It can be modified and it can also be upheld or affirmed. And if it is affirmed, then it's actually treated the same from the point of view of the legislation as a notice that the inspector has issued. Okay, and there are penalties outlined in the legislation for things like failure to comply or display the PIN and so forth. Now, if you've written a PIN and you've noticed there's something not quite right, it is possible to make a minor amendment just to clarify or correct an error. So just a small change rather than something fundamental there can be corrected. All right, so the broader obligations of the PCBU to the health and safety reps. They must consult, they must have a system in place for consultation and provide information. And it is a function of health and safety reps that they can accompany an inspector while doing inspections and attending meetings. However, there's also a level of discretion for the inspector, because it can be that there's parts of an inspection that might not be appropriate for, or people that they need to speak to individually as well. But that can be one of the functions. Providing reasonable resources and assistance to the health and safety representatives, and that's often clarified in terms of the time and other facilities that might be required to do that role. And also, there needs to be information at the workplace about the HSRs and deputy HSRs. Importantly, there is legislation around offences to discriminate against actions HSRs are taking in their role as an HSR or to threaten them in any way in relation to that role. Now, HSRs can be so kind of fundamental in helping get some good conversation going at the workplace, identifying hazards, identifying practicable controls and risk measures. So WorkSafe really wants to make sure that we're promoting that role. We think it's just a really important lever. The number of health and safety reps in different workplaces across the state, it's a really important way that we can actually really drive change in workplaces. So we are looking to promote the role and support the role further. And some of the things we will be doing as a strategy towards that are some targeted advertisements around the role, educating PCBUs further about that role, and also we're developing a website which we're hoping to have some level of interaction on that, so HSRs can actually have a discussion or seek advice on issues and provide additional resources there, because while we've heard earlier about the training that's available, we think that there's opportunities for HSR, some of whom are doing the role for many years, to build their skills and knowledge over time, and we want to be able to better support that. So the website is going to be a big way where we're going to do that, and we will be communicating on that when that comes out, and I'm hoping in the next few months. So that's something to look out for, and stay up to date with our newsletter, our email newsletter, to hear when we announce that's gone live. We're also, we advertise and promote the HSR of the year, and we'll be doing some further testimonials around the value of HSRs and the role. So we've also been providing WorkSafe information and education. So between January 2023 through to September, we've had community education officers presenting the role of WorkSafe, and they've done that to 3,666 trained HSRs or deputy HSRs over the course of that part of this year. All right, just a little bit on how the training's going. The Work Health and Safety Commission require the training providers to provide information on the delivery of the introductory training courses. So in the 2021 year, there were 432 courses conducted and arranged, so 169 of those were regional and 263 were metropolitan. And that was 3,882 HSRs trained, and the biggest component of those were from healthcare and social assistance, and the second biggest being education and training. There's also, or actually probably the mining and petroleum collectively, not that that's a job role, but as a sector, that was actually a really big sector as well, which I'll show on the next slide. So you can see there that the mining-related ones are in yellow, so that sector is well represented. General industries are in the blue there, and yet there's some in relation to marine as well, and some that we don't seem to have the records or wasn't clearly stated. In terms of the different occupations, we had quite a significant group there from plant and machine operators, which is the blue. They had the professionals, which is the green, tradespersons, which is significant as well, and labourers and related workers. So that's some of the sectors that we're currently seeing significant trainees in. So we'd definitely like to recognise the health and safety reps in the room and appreciate your role in making safer workplaces, and your, the efforts that you go to try and get those issues resolved, get them raised, and listen to people and also communicate with others. So we really appreciate those endeavours, and we look to increase our support. What I'd also like to mention is WorkSafe's upcoming strategy over the next 3 years. So it's called WorkSafe The Way Forward. We'll be releasing it later this month, so I haven't put a slide because this is just a little verbal kind of preview on the strategy before it's formally released. It's going to have 4 main focus areas, and I'll just talk you through those. So the first one is around repeat hazard exposure. Now, repeat hazard exposure is where we know and we can see that we're having similar issues occurring in an industry or in a task over time. So those kind of critical issues that we get ongoing trends really of serious and fatal incidents. We've kept it fairly broad so that we can actually adapt it to use across different sectors, but some of the sectors that will have special attention in this area will be agriculture, as we know they've got the highest rate of fatalities at the moment. We've got the mining and petroleum sectors, we've got construction and transport. So there's some of the ones that are overrepresented there. Now within that, obviously we're going to do some work around breaking down different causes of those kind of events. But that's a priority that's intended, that we'll map some of our work to, and we've got the aim to reduce the fatality rate in line with the National Work Health and Safety Strategy that's published by Safe Work Australia. So that's the first component. The second component, and I see some shirts in the room that probably align to this one, it's around respiratory hazards. So we'll be focusing on a range of things that aligns to our existing dust strategy. But as we all know, we've got issues with silicosis in Australia at the moment. We've also still got issues with asbestos. We've got a lot of asbestos in Western Australia. The rates of mesothelioma, while there's obviously a long lag period between the exposure and the illness, the rates of that illness, we haven't turned any sharp corner where there's still 700 mesotheliomas per year in Australia, and WA is well and truly overrepresented, so that remains a high priority for us, that asbestos is managed properly and that it's removed safely and that people are adhering to the requirements of their licences. So that aligns with the National Strategic Plan for Asbestos as well, which is run by the Asbestos Safety and Eradication Agency. Also, in terms of the respiratory area, what we're going to do is some work around emerging minerals, just to make sure we've got enough information available for those newer products that are being developed. The third one, and again echoing what we talked about earlier, is the psychosocial pillar. So we're aware that psychosocial claims have been rising. Unfortunately, they aren't as high here as they are in the eastern states, but they are still of concern. They're a costly kind of claim, both for an individual that's affected and for the PCBU that's dealing with that. And the time that those take to resolve is an issue both for the affected party and for the workplace. So they are definitely a priority. And we think there's a lot of capability development and building that can be done in that area. And then the fourth one is aligned to what we've been talking about today, which is around consultation and the work we want to do to promote consultation and enhance the support that we're providing to HSRs, and again, see if we could get more workplaces with constructive consultation mechanisms in place. So we will be releasing that in a format later this month, and again some information will come out about that, but I thought I would just take the opportunity to speak to that. I will now go to my colleague Steve, and we will hold off the questions, I believe, until we've all spoken, in case Steve answers all of your questions as he's talking, and other than that I'm happy to take any questions shortly. Thank you.